listeners out there in the land of blockchain and otherwise. My name is Alex Manders, and I'm a director at the Information Services Group. My core responsibility is to lead and manage our ISG Blockchain Now global and services and solutions line. And I'm joined with my two colleagues, Jason Stading and Cole Flashenberg, as we explore the world of blockchain with a number of guest speakers and leaders, specifically from Dole, Bear, MediLedger, Hashed Health, and Sprint. Our guest speakers are going to talk a lot about different applications and use cases as they relate to supply chain and otherwise. And we hope that you will find some value throughout the course of the series. Today, we would like to introduce and welcome our guest and longtime friend, Mr. John Bass of Hashed Health. And John, before we jump into the Q&A here, why don't you give our listeners a little bit about your background and Hashed Health?
Well, first of all, thank you for having me. My background, I've been in healthcare technology for about 25 years. I was really fortunate to get out of school and get a job at Vanderbilt Medical Center right as the kind of the .com world was starting to really come together. And so in the late 90s, I was part of a startup called impacthealth.com, which was kind of using the internet to bring together hospitals and their supply chain trading partners on a new way to move supply chain information. So we basically stood up a network that allowed these trading partners to move information that was previously manual over the internet. And so that company grew up and through a few acquisitions is now called Global Healthcare Exchange. So that it's being used by a lot of your customers and kind of folks in the supply chain space today. And so, and then after about 10 years, I left there to help start another company called InVivoLink, which was trying to manage orthopedic and spine episodes of care using a software envelope that wrapped around the episode and collected supply chain data, implant utilization, practice pattern data, patient report outcomes measures, and we engaged the patient and educated the patient in a variety of ways. And so those two companies kind of were all about using technology, bring together networks of healthcare enterprises and help them work more efficiently and effectively in new ways through collaboration. And so if you know anything about blockchain and derivatives of blockchain, you know that it has everything to do with that kind of bringing together networks around shared value, creating kind of these ecosystems of new types of business-to-business transactions that improve trust and improve transparency and align incentives across those networks. And so we sold InVivoLink to HCA back in 2014. And then in 2016, I left HCA to start Hashed Health. And today we're Hashed Health, and the market itself has matured a lot over the last 4 years. And we've been fortunate to have a front row seat in the development of a lot of different technologies, mostly kind of experiments, but now those experiments are maturing into real commercial solutions. And we've done that in partnership with a lot of big healthcare and life sciences companies, leveraging all of these really interesting new business models that are enabled by blockchain technology and allowing those enterprises to come together and solve shared problems. So it's I just having a really good time watching my company Hashed Health develop and watching the market develop and really innovating in terms of technical solutions and business models and these networks coming together. It's a really fascinating space, and I'm excited to talk to you and your audience about it.
Fantastic. Thank you, John. We certainly appreciate your time and support with the podcast today. So let's just jump right into it, John. The first question I'd like to ask you is kind of walk us through the listeners, how you became interested and involved with blockchain as an emerging technology.
Yeah, it was really born out of those prior companies. I think I had always been really involved in kind of using technology to collaborate. I mean, everyone knows that healthcare is a team sport, but we really are terrible at collaborating. We still work in silos. Whether it's pick your value chain, supply chain, or the claims life cycle, payments, the pharma life cycle. All of these kind of value chains in healthcare are really siloed and fragmented and are full of kind of big middlemen who oftentimes are extracting more value than they're adding. And it's all built on top of siloed infrastructure, these databases that don't share information very well. And so we wonder why costs continue to climb unabated as we build solutions on top of the legacy infrastructure that doesn't understand the relationship between business and clinical data, or doesn't understand how the flow of dollars is in relationship to the flow of data. So I've lived those challenges at NvivaLink and at GHX. GHX, for example, is very good at supply chain data, but as we realize, there's a real need to understand the relationship between those supply chain data flows and the clinical and other business and real world data flows that exist outside the supply chain. And the next level of value in a lot of supply chain use cases is going to only be realized if we can bring those flows together. Same thing's true with my experience at NvivaLink around value-based contracts, bundled payments, and those types of kind of risk-based or outcomes-based or value-based agreements. Those things will not scale and will continue to have really heavy administrative burden unless we learn to bring together dollars and data. And so blockchain, as I kind of had sold NvivaLink to HCA, my antenna was up and I really kind of started to understand what was happening in the financial services and fintech space around the use of blockchain for financial services transactions, and how they were starting to streamline, banking communications and banking transactions, and how Bitcoin, the premise was to really disintermediate the bank and move that trust function to a protocol, an open source, consumer-focused protocol. And it was not hard for me at that point to start to connect the dots between those types of solutions that were happening in the financial services space to a lot of the problems that I had been living with in the healthcare technology space. And so I kind of, once I connected the dots, I just really started to dive into the technology. I created the Nashville Blockchain Meetup back in 2015 here in Nashville, and I started traveling around to the Ethereum DevCon conferences and learning more and more about the community and about how real it was and about the really exciting and innovative work that was happening. And so I just couldn't. It was one of those things where the troops were on the ship, and I just kind of felt like I had an obligation to go out and help develop this market. And so in 2016, I decided to go all in on the technology. And so really, to answer your question, it was all about solving a lot of the problems that I'd been living with in terms of the things in healthcare that I cared a lot about, like value-based payments. I believe that's the future, and I believe that you can't solve it without this type of infrastructure that helps promote trust and transparency and incentive alignment across the ecosystem.
Fantastic. Wow, it sounds very extensive, and you've got a wealth of knowledge that I'm excited for you to be sharing with our listeners today. And just given your journey with blockchain, what is it that has kept you excited about the technology over the past several years, especially when we hear things that, it's been adopted, it's not been adopted, the trough of disillusion, confusion with different applications. So what is it that's kind of kept you excited and pushing your vision forward?
It's such a dynamic space, and there's so much potential to really connect the use of the technology to these really big problems with our care delivery system, especially here in the United States, but really globally. I mean, the same kind of underlying issues can exist everywhere, but we feel it very acutely here in the U.S. because we're approaching 20% of GDP, and it's really creating problems for our employers and for the government. And so, I just very clearly see the link between the capabilities of this technology and fixing what I think are a lot of the underlying issues that hold us back from improving the system. And I think it's the kind of thing that where the country is headed for a crisis sooner or later if we don't do something. And so, it all goes back to the real belief that what we're working on has the potential for real impact on consumers and communities across the country and across the world. And it's directly tied to the really important issues such as health equity and creating communities of health that everyone is trying to figure out. I mean, it's just a lot of it goes back to trust and transparency and incentive alignment. And if you look at the big healthcare delivery systems and companies, enterprises in the world today, they've got to change the way they operate to be more trusted, to be more transparent, and to be aligned with the other constituents and stakeholders in the care delivery models. And so I believe that in order to get there, we need to lay down new rails, new infrastructure upon which these more collaborative and shared value ecosystems can exist. And so that's what's kept me excited. We've had all this kind of ICO stuff, and since the very beginning, there's been a lot of hype in the space. And even back in the 2016 days before the ICOs, there was tons of hype, but that hype is also what makes it exciting. And I think it's really just important that you are intentional and you understand and kind of are open to all these ideas, but you formulate your theses and your experiments where you validate those assumptions around how do you get from where we are today to this beautiful future that's promised by the advocates of blockchain. And I think everyone has value to offer in what they're saying and their ideas. But I think the reason we've been successful and the reason I remain excited about it is because we've got kind of a thoughtful, practical plan to iteratively mature our company and the solutions that we deliver to solve real problems for real companies in today's world as we work towards that beautiful dream of a lot of people hold for the technology.
Fantastic, and thank you for the background there, John. What I think is most important if we take a step back and try to perhaps give our listeners some insight into how this applies to healthcare in their daily lives, right? So most of us interact with the healthcare industry either directly or indirectly through someone that may be leveraging a healthcare service of some type. And if we even bring it home to the current state with things like the coronavirus and all this talk about the potential epidemic, things like that, kind of walk us through what should your average person understand about blockchain as it relates to the healthcare industry?
Yeah, I guess at the meta level, we all feel this sense of distrust in a lot of what's going on in the world today, and healthcare is very much part of that. Like the the stats, and I don't have the statistics in front of me, but trust in insurance companies, trust in pharma companies is at an all-time low and just getting lower. And meanwhile, these companies are making record profits a lot of times. And you've got, and the problem is just going to get worse as we bring to market precision medicine therapies, gene therapy, cell therapies, curative therapies. All of these things will not come to market and won't scale up unless we fix the underlying kind of trust and transparency and alignment issues between the creators of these products, whether it be insurance products or pharma products or medical devices, and the end consumers who are having or that are in need of them. And so I think, again, at the highest level, this is about creating alignment and trust in care delivery and in the delivery of products and services. I think the technology has the ability to make that care delivery more equitable and more fair and more dynamic in terms of how it's priced and how in the insurance products that are used to get it to the right people, and how it's paid for. And so, the way it will, so that's kind of the high level. For the average person, I think the best blockchain solutions you won't even know it's blockchain. It's going to be. Blockchain will be abstracted away from the consumer, and what you'll see over the next, 3, 5, 10 years, certain use cases may take longer, is new types of products that are more aligned with what you want. Insurance products that don't, insurance started off being for catastrophic problems, and over time, it has morphed into something else, as one example. And so, I think startups and existing companies will start to leverage this technology to become more aligned with their consumers and stop competing with their consumers where they're, oftentimes selling their data and things like that. So I think, these are my kind of longer term hopes. A lot of people ask about crypto and whether crypto will be also a part of this, and maybe so over time, not in the near term, but certainly new ways to pay for products and services, including the potential for programmable value transfer. I think is a really interesting concept, and will probably become reality in certain situations, at least over time. I think it's just going to take us a while to get there.
I agree, and especially on the use case itself and how long it's going to take. And that's actually a great segue into my next question. You've stepped us through some ideas on where and how blockchain can be used in the healthcare industry. So if you'd like to expand on that a little bit, as I then kind of get into how do listeners or organizations measure return on investment in blockchain projects? We all talk about it, organizations are doing it, and there's different challenges that they each face. But from your experience, what recommendations would you give to the listeners on how to achieve an ROI and how to really measure value with a blockchain project based on what you do day to day?
Yeah. Well, that's a great question. And, projects that don't have an ROI are really going to struggle with product market fit. And I think that's a big problem that we've had over the last 4 years is, there's been tons of ideas for use of the technology. And it's not that these ideas are bad. It's just that oftentimes the business model, the non-technical stuff hasn't come together. So the great use of the technology, because there's a multi-party, multi-system trust problem, but how do you get all the necessary members of that network to come together and share a governance agreement, share a contract, share a workflow? And what is the ROI for them doing that? And so I think, a lot of the advancements over the last, at least for us at Hash, over the last 2 years, have been as much non-technical as they've been technical. And I'll give you the best example is our, it's not a supply chain example, but it's around professional credentials exchange, which is probably one of the hottest healthcare blockchain projects out there. It is a new way to credential physicians, which addresses a big revenue cycle problem here in the United States, around the time and effort and cost involved in getting physicians credentialed and active and being able to pay them to treat patients. Right now that process is manual, offline, analog. It takes about 4 to 6, sometimes even more months to get that physician credentialed, and you're losing around $9,000 per day in revenue for each physician during that process, and you got to redo it every 2 years. So what the blockchain allows us to do is create digital assets out of those credentials. And so the primary source verification work is what we need to prove. That's where there's a trust problem here. And so by creating a digital asset out of those digital artifacts that are sitting in a health system or some other database, and allowing those digital assets to be traded while you can mathematically guarantee the authenticity or the pedigree of that piece of data, is kind of what the marketplace does. So it enables both sides of that marketplace to really create value. The buyers of those assets can acquire credentials, primary source verified credentials, more cheaply and much faster than they have been able to do so in the past. And people who are selling those artifacts can create value from what is currently a resource that's sitting idle in a data center today. So we're freeing up, we're making liquid this information that's valuable to the market. So it's this kind of idea of a community curated marketplace for this data. And it also opens the door to us looking beyond the traditional definition of credentialing to really free ourselves to create a better world of what is really kind of the information that the modern world wants, above and beyond where did you graduate, what's your employment history, and do you have any malpractice investigations against you? That things like quality measures and how many times have you done an anterior approach hip versus a posterior lateral approach hip. Now, these are things that have a lot of meaning in terms of quality, which have a lot of meaning for any kind of value-based or risk-based relationship. And so in order to move forward with those types of programs, this is expanding how we've traditionally looked at reputation for physicians and other clinicians, meaningful solution. And so there is an ROI there, very clear, very attractive ROI, which is the reason that this project is maturing so quickly. It's recently been spun out of Hashed Health. Professional Credentials Exchange is now wrapped in a network of 15 large name brand insurance companies and healthcare systems. It has recently raised a $3.5 million seed round to commercialize in partnership with those partners. And so the reason it's been successful is the ROI. It's not because it's a blockchain solution. People don't care. That's a hair on fire problem. And all of a sudden, because of distributed ledger, we now have a new way of solving that hair on fire problem. And so, I would suggest that if you don't have a very clear ROI, you really need to think twice about how far you take that project. And so, right now, the sweet spot for blockchain are projects that can pretty clearly demonstrate a return on investment. Those are the ones that will be moving quickly in 2020.
Yeah, and kind of to build on that topic of things that you mentioned earlier, blockchain being a team sport, organizations collaborating to achieve a return on investment, kind of leads me to the question of consortia. There's, based on ISG's research, close to 100 consortia globally, public or private, across a variety of industry. Kind of step the listener through your definition of a consortia and how people collaborate through these types of working groups, particularly Hash Health, to achieve value. Like, what does that model look like, and what can the listeners learn from it? Whether they create their own consortia that's public, or they go out and find a peer company to work with in a private consortia. Just kind of walk us through that based on your experience.
Yeah, I think people use the word consortium, and that we use that word, but some people think of consortia. That word is, they have certain thoughts in there. That, one way to also think about it is just the network of businesses that are involved and eager to see a project come to life, because they're using this new technology to collaborate around a shared problem, and so there's value in them participating. And so it's a network of companies that are coming together to solve a shared problem. And you have to have the minimally, in order, in the blockchain space, you need a minimally viable product, and you need a minimally viable network of entities to bring that solution to life. If you're missing a key group of customers or a key member of that network who needs to participate in the solution but doesn't see value, then you're at risk of the network failing. So, if you're trying to create a solution that creates alignment between insurance companies and pharma companies and healthcare systems, but the healthcare systems don't see the value in participation, so you're left with a great network of pharma companies and insurance companies. Well, that you may need to rethink your use case, because if there's no value for the health systems, but you need them, then it's probably not going to work. So the network in the blockchain space is really, really important to realizing the value proposition. And so there has to be an ROI for those members. And at Hash Health, we have a very kind of, the studio model that we have. There's a very iterative and intentional and thoughtful process by which we bring projects to life. It starts with kind of an experiment or an idea, and maybe an anchor customer. And there's a lot of iterating that goes on, the technical and non-technical aspects of that project. And once we feel like we've got alignment around the business model, the technical model, and the network or governance or consortia model, then we go out and oftentimes we, at that point, have built a prototype, and we'll go out and start recruiting a network and that's a process of validating our assumptions. And once and a lot of times there's kind of these feedback loops that happen where we kind of iterate on all of that. And because that feedback from the other constituents may serve to inform our business model or our technical model assumptions. And then once we kind of done that for a while, we've got a technical model, we've got a prototype, we've got a business model that's apparently attractive to this network. And we've gone out and we've recruited all the necessary members for a pilot. And then we go run that pilot. And then if we're successful there, and sometimes there's more feedback loops, then we move towards commercialization, and we'll oftentimes, in our models, start to position that new entity as its own kind of joint venture or spin-out company, and we'll go out and raise money on that. So that's what we did with Professional Credentials Exchange, and that's kind of the model that is working well for us. But it takes a while, and we're trying to tighten that up. But that's generally the process. So the consortia or the network piece is a critical validation step in order to make sure that we don't bring things to market or create products or solutions that are not going to be successful.
Wonderful. And so, John, before we transition over into a handful of questions that we're going to ask that are standard to all of our guests in the podcast, I want to have Cole kind of ask you some questions around education, or a specific question around education, because we typically hear this a lot in talking with the firms that we interact with. So let me transition over to Cole.
Yeah, hey John. So for any of our listeners that kind of want to get involved in a blockchain solution and don't really know where to start, what types of education do you think that the industry and enterprise teams need in order to be successful with shaping a blockchain program?
Yeah, that's a great question. I think if you go out and read just kind of everything that's out there, you probably are gonna it's going to be difficult because you're going to see a lot about crypto, and you're going to see a lot about these dreamy use cases that are not bad, but they might take a while for these things to come to life. And so most healthcare companies are looking at doing kind of meaningful work in the near term, and they're expecting some kind of ROI or value to be created through that work, not just to experiment. And so, I think that's the reason that we, Alex mentioned a lot of our research that we do at Hash, and, the blogging we do and things like that. That's in an effort to put out kind of practical, pragmatic thinking for enterprises to consume as they're considering these projects. So we see that as a market development activity. And I know you guys do the same. I think you and other kind of agencies like yours have a real role to play in terms of laying down kind of the business and technical architectures that are formative for those companies. So I think, a lot of the real work is happening through these consortia, and we've got a list of those consortia, as do you. I think we focus on the healthcare market at Hash, but those consortia and following those consortia and understanding, the models of those consortia is really informative. What are the use cases they're focused on? What are the trends kind of across these consortia in terms of technical models and business models and governance structures? That will really serve to inform you as to what's real. Because if you've got, all of the biggest insurance companies in the United States and all of the biggest pharma companies in the world who have been working on this stuff for 4 years, and then you've got groups like, thought leaders like Alex and, the work we're doing at Hash, who've also been doing this for 4+ years now. The things that we're doing and things we're saying we're doing that because these are validated ideas and concerns. And so, I think that's one of the, I would steer you towards those resources. I would also say that there's nothing like being involved to learn. So there's low risk, potentially high reward projects that you can get into as a company to get up to speed. And then, in terms of like other resources out there, the things I personally listen to a lot are like the A16Z podcast and, things like, non-blockchain stuff where I, at this point, can connect the blockchain thinking to Harvard Business Review's, blogging, or New England Journal of Medicine Catalyst blog or podcast. This is really about healthcare and healthcare delivery. And you should see blockchain as just an enabling technology to solve problems that exist out there. So anyway, hopefully that helps your audience understand kind of at least how I think about gathering information.
Yeah, that's fantastic. And so John, we have a couple fun questions that we wanted to ask Jason and Cole. Then we're going to ask them to all of our speakers, just so that the audience gets an opportunity to be able to relate to you more as a person, not necessarily or always just a blockchain subject matter expert. So that said, I'm going to let these guys kind of ask you 4 questions, and in sequence, and we can go ahead and kind of start with Cole.
Yeah, sure. So, John, what's a low technology hobby that you have and enjoy doing in your off time?
Well, right now, hashed for whatever reason, I'm sure, and I'm going to write a blog about this because there's a reason. I just got to think through it. But our team over time has been staffed in endurance athletes. We all are Les and Alex and I and the others. We're all into kind of distance running and trail marathons and things like that. And so that's kind of my big hobby right now. Is to go get on the trails here in Nashville on the weekends. And I ran 15 miles yesterday, and I'm training for some races this year. And for some reason, that's just really, and it's definitely low tech. It's your shoes and that's pretty much it. I don't even wear a watch or really do any of kind of the data tracking stuff. I just kind of get out there and see how far I can go and how fast I can go. And so that's the first thing that comes to mind in terms of zero tech, disconnecting and really kind of listening to yourself for a while. I think there's a lot of important things that happen out there on the trails.
Yeah, that sounds great.
Yeah, and I would agree with that, John. When I used to be an avid runner, I would also wear no watch and just go run as long as I could before I needed to stop. So
before you ran out of breath.
Yeah. Exactly. So Jason.
Yeah. So if one of the questions we have here queued up is if you could create a technology to do something that you don't like to do, what would it be?
I love my wife dearly, but she is the kind of person that loves, especially on weekends, and we're doing this on a Monday, so this is fresh on my mind as well. And it actually happened after I just run my long run. She loves to like rearrange our house, and she loves to move furniture around. And then oftentimes I'll move it, a couch or whatever it is, and then she's like, "Oh, I don't like that out." So if you can come up with maybe a in-house robot at some point to help me with that problem, that would be greatly appreciated.
That would help a lot of people.
Yeah, you can start with the Roomba. Yeah. I just got one of those things. It works pretty good, but it is technology, so it cleans the floor. But yeah.
I share your pain.
Yes. Cool.
Yeah, John. So my last question is, what's a career aspiration that you've had, either technology or non-technology related?
Oh, well, I guess if I were to say what I really aspire to, is really, all I can think about is kind of Hashed and the projects that are coming out of Hashed and this kind of studio model that we've built where we're working on all these amazing projects with all these amazing partners. And I think, what I aspire to is I aspire to seeing blockchain move from just a B2B kind of thing, which it is primarily right now, towards the consumer in healthcare. And I would love to know very directly that the work that we are doing is empowering individual consumers and communities of consumers. And I think that's, if I could think of one thing, over the next 5 or 10 years that I would love to see unfold, it's that. It's really understanding very, very clearly through data that what we've done has improved care delivery and reduced cost for consumers of healthcare. That's probably what I'd say.
Thank you, John. All right, we'll give Jason the last question.
Yeah. So right now, what is your favorite technology application or device that you have?
Question two. I think the first thing that came to mind would probably be Bitcoin, because it's where I'm in my office and I'm staring at my Mastering Bitcoin Andreas Antonopoulos book, which was the book that I've got kind of sitting on my shelf that kind of inspired a lot of what we do. And so, Bitcoin, like it or, I just think it's just this fascinating innovation that has launched so much potential. And so anyway, I think I'd have to say Bitcoin is currently my answer.
I love it.
Fantastic. Well, thank you, John. We certainly appreciate your time and joining us broadcasting from Austin, Texas, and you being in Nashville, Tennessee. And by all means, we look forward to remaining in touch with you. And if there's any questions, we'll make sure that the listeners have a way to reach out to you directly. Yeah.
That sounds great. Thanks for inviting me on your show.
Well, we hope you found today's podcast episode valuable and insightful. And on behalf of the Information Services Group, Jason Stating and Cole Flashenberg, we'd like to thank you for listening. And we encourage you to listen to the future episodes. And also, with any questions you might have about ISG or ISG Blockchain Now, please visit isg1.com to learn more about our firm and what we do with blockchain. Thank you.